Let me just invite our guest speaker for today. Hello everyone. If you guys have any questions, please you can go ahead. Hello. Good evening.
Hi, good evening.
So we'll wait for some time to let everyone join.
Sure.
Until then, could you maybe introduce yourself
Yeah. So
to
hello
everyone?
everybody. I'm Dr. Charan. I'm a neuropsychiatrist. Um, so what I do, I think we're going to talk in our discussion.
Mm-hmm.
So
Mm-hmm.
I work from Hyderabad. I'm working in a multi-specialty hospital called KIMS. Uh,
Mm-hmm.
yeah, that's what I do. I also do. I'm also into art, photography, a lot of craft. I dance. I learn hip hop. Uh, So yeah, I mean, I try to do multiple things other than just being a doctor. That's what keeps me sane. So yeah, that's about me.
Thank you so much for the lovely introduction.
Yeah,
Um, Before we begin, I would like to thank you for taking the time out of your schedule and talking to us about your experiences, talking to us about stress and mental health.
yeah.
So,
Most
my first question for you is that what was your journey of becoming a neuropsychiatrist? Or did you face, any hurdles or obstacles in your journey?
I think I can talk about my journey for like 2, 3 hours, boring everybody, but like I'll keep it
In your
brief.
years?
Yeah. Yes, of course. I mean, just like any other course, like there are definitely hurdles, but I think when you enter into field of medicine, the hurdles are a little more probably because I think the course itself is very complex and it's
Mm-hmm.
so volatile. It's like ocean. You're just swimming and you don't know where you're gonna reach the other end of the thing. Even today, I don't know. Yeah, I'm still swimming. I feel. So hurdles in terms of that, yes. And when you expose a 18-year-old boy or a girl uh, to into a medical college, the first thing we start with is cutting up a dead body. We dissect the dead body, which is very difficult. For you to process, like, this
Right.
person is dead, and I have to learn from this dead body so I can prevent people from dying. I think just to get such a complex thought into your head for somebody who is 18 years, it's very difficult. I know a lot of people fainted at the dissection table in anatomy classes. um, but yeah, I mean, but at the end of the day, I feel like it is worth it for sure. Other than just the violence that is happening against the doctors, other than that, I think we never, we as in like I'm speaking for everybody. I think nobody feels that it's not worth it. Um, yeah, I mean, I think the feeling is great, so might as well just go through all the hurdles. And
Right.
specifically about neuropsychiatry, the hurdles are definitely a tad bit more, or maybe a little more than tad bit, because a lot of people discouraged me into taking it. They told me that why don't you pursue like cardiology or general surgery or dermatology or different branches? Why this? I think if any medical students are following, you'll all know. I think you will grow to love one organ of your body as a medical undergraduate. It could be liver, it could be stomach. It's just you'll weirdly get obsessed with that organ. So brain was that for me. So I had three options: neurology, neuropsychiatry, and neurosurgery. Surgery was not my cup of tea. Like surgery doesn't, that lifestyle doesn't interest me. Like I said, I paint and all that. I can't do any of that. If I'm a surgeon, I don't have fixed working hours. I had to go in the middle of the night. It doesn't work with me. Neurology is not a direct branch that you go into. You would have to take a general medicine and then go to neurology, whereas neuropsychiatry is straight up. So I thought, okay, it is about brain. It is something that I like, and myself personally went through clinical depression in my teenage. So I thought, that gave me like a little bit more boost that this is very cool, because I felt horrible when I was depressed. I thought like nothing can fix it because I thought, oh, it's not a physical condition. How can anybody fix it? But when I started taking medicines, when doctors were talking to me, I mean, I just got so much better. So for that reason, I think naturally I got more curious towards this area. Yeah.
Right. Right. Okay. And talking about neuropsychiatry, what kind of patients do you see, or what kind of conditions do you cater to?
So let's, on a simple terms, I'll classify into three groups of patients I see. First is all the neurology cases that present with psychiatric symptoms
Right.
is what I
Okay.
see. So if you can come with migraine, you can come with fits or seizures, we call it in medical language,
Okay.
or stroke presenting as a psychiatric problem, Parkinson's
Mhm.
disease presenting as a psychiatric problem. So the psychiatric aspect of all the neurological diseases is taken care by me. Then purely psychiatric diseases is also taken care by me, like schizophrenia, ADHD, etc. And a bit of not a disease, but just the behavioral problems. You just been cranky. You don't have a diagnosis. You're going through some
Okay.
stress in your
Okay.
marriage, or you had a heartbreak. That part also slightly I take care of, but because of the time constraint, I don't get into therapy too much, because I see the volume of patients I see is a lot in a day, so I can't like sit with the patient for 1 hour. So for
I
that
see.
reason, I don't practice the third part of it too much. I send them to a clinical psychologist whomsoever requires. But other two parts, I think I'm pretty good to go. Yeah.
I see. I see. There's a question in the chat. So, do you do the scans first or the psychiatric assessment first?
So they go hand in hand, just like, if you go to a diabetologist or
Mm-hmm.
anybody, they go hand in hand. While I'm talking to you is when I get the information. If there is a need for scan, mostly, 50% of the cases, they don't need any scan, but 50% if there is sudden onset of any symptoms, no family history, no genetic basis, no all the other metabolic and, let's just say you're not diabetic, you don't have thyroid condition, nothing. Suddenly you
Mm-hmm.
had this, and then just to rule out any bleed or anything, because a lot of people think when you have a clot or bleed, you will have a stroke. Stroke can also present as psychiatric manifestations. Stroke can present as hallucinations. Stroke can present as sudden irritability and violent outburst. That also could be stroke. So we'll have to rule out that. Otherwise, you don't want patient to like really deteriorate. So for that reason, we would do scans if I think it's an emergency. Otherwise, not really. But most of the time, patients ask me to do scan for them because they want to be sure.
Right, right. So, someone in the chat says panic disorder can be cured without medical needs. So, do you want to say
Panic
something?
disorder cannot be cured without medical needs. Mild anxiety can be cured without medicines. Panic disorder is the most severe form of anxiety, or the worst form of anxiety that you can have. It resembles a heart attack. So panic
Right.
disorder must take medicines. Mild anxiety, not no need of medicines. A little bit of therapy, a little bit of deep breathing, and some exercises should be fine.
Yeah, yeah. So, coming to the main topic that we're here for, uh, we have all been under a lot of stress, not only during the pandemic, but also before that in our day-to-day lives. So, how does stress manifest itself? So, what are some of the symptoms that stress presents itself as?
So stress can present in many ways than one. When we were reading MBBS, when I was doing my MBBS, all the
Mhm,
textbooks, every disease, under that, there is a risk factor group that we read. Under that risk
mhm,
factor, stress was there. I was thinking, Arey, what is the stress that in every disease there is stress? That's the only common thing that I'm seeing. I saw it in cancer, I saw it in hair loss, I saw it in depression, I saw it in, multiple things. So I was wondering, like, what is stress? Because I didn't know what exactly, like, even now, most of us don't know what exactly is stress. We just say that we are stressed. So
mhm,
then, obviously, like when I took MD, I understood what it is. So whenever our body is, put in a, mode of threat, it could be a real threat, it could be imaginary threat. For example, I saw a snake right next to me while I'm talking to you, or I'm sitting and imagining what if there is a snake next to me right now. It could be real or perceived. Both of them will trigger same amount of release of anxiety hormones from your brain or pituitary gland onto your body. it affects in many different ways. So just imagine yourself getting stuck in elevator or watching a most scariest of the horror movies. What all symptoms do you feel are the ones you would feel in higher intensity if you are stressed. Starting with, we'll start with physical symptoms, then go move on to psychological symptoms. First thing would be your heart beats very fast, or it beats loud. You can hear your own heartbeat. Even in movies, you see whenever there is a like a scary scene or stressful scene, the background music turns into heart beating very loud. That is called as
Right.
palpitations. Palpitations is by
Mhm.
far like one of the worst or scariest presentation for someone because they'll think that they're having a heart attack. Patients tell me that I feel like my heart is going to come out of my mouth. It 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 was beating so loud and fast. That's the first symptom whenever you're under a lot of stress. Second would be
Right.
breathing difficulties. Even though I'm in a well, let's just say I'm sitting in a nice park, there is so much of
Mhm.
oxygen, but still I feel like I'm gasping for breath. It doesn't have to be so dramatic. People think it has to be that
Yeah.
dramatic. It can be a little bit of feeling restless or feeling that your chest is tight or feeling like you're going to faint, lightheadedness, or your vision gets a little bit blurred, your mouth becomes very dry, you have the urgency to go and urinate, you
Mhm.
start having headache, neck pain, back pain,
Right.
multiple body
Right.
pain. Our body feels very stiff and rigid. You're not able to relax it. Some people keep shaking their hands when they're stressed, but they still can't relax it. All these are physical symptoms of how stress would manifest in itself. And there are
Mhm.
psychological symptoms where you'd feel very restless. Right now, when I'm talking to you, I'm very relaxed. But let's just
Mhm.
say I'm under anxiety, I'll be very restless. I'll be sitting on edge of my seat. I'll be moving. You can see the physical restlessness or mental restlessness, fear, excess fear that this might happen, that might happen.
Mhm.
Thoughts, a lot of negative thoughts. One thought doesn't lead to the second thought. One thought leads to like 16 other
Right.
thoughts that would lead to maybe
Right.
32 other thoughts that have no relation.
Mhm.
That can happen, and you feel like you're gonna die. That kind of thing also can
Mhm.
happen. So stress can manifest in the form of anxiety. This is all what I explained to you is anxiety. It can also
Right.
manifest in the form of depression. It can also
Mhm.
manifest in the form of substance abuse,
Mhm.
drinking, smoking, cannabis,
Right.
whatever.
Right.
It can also
Right.
manifest in terms of behavioral problems where you are irritable. You having interpersonal problems with your family members because of your anger issues, or you're having problems on the road. You're having road rage, or you're going to
Mhm.
work picking fights with other people. That also can be part of stress. You're
Right.
overeating or undereating. You're oversleeping or sleeping less. All this can be at least the tip of the iceberg of stress. Then
Mhm.
cancers and all that. I don't want to get into. Yeah.
Mhm. There's a question in the chat again. What can the patient do at home before going to the doctor in such a situation of, anxiety or a panic attack?
I think one of the important things is to breathe deep. You know, we see it in movies, we see it in like, all everybody keeps telling just take a breath. Why
Right.
breathing is so essential is because I'll explain the reason. Probably I think people will register it better. There is a muscle called diaphragm between your chest and abdomen, right somewhere here, little below. There's a muscle.
Mhm.
So whenever you take a slow deep breath, your lungs expand because of air fills it up, and then the diaphragm also expands. When the diaphragm expands, there's a nerve that connects your diaphragm to your brain,
Mhm.
vagus nerve. It also connects to your heart. What it does is it sends signals. It's called negative feedback mechanism. It gives a
Mhm.
feedback to the brain to reduce the secretion of anxiety hormones. So immediately, brain will tend to reduce anxiety hormones a little bit. So immediately you'll feel better naturally. But
Mhm.
in case of panic attack, when you're already hyperventilating, it might be difficult for you to take a deep breath.
Mhm.
That first visit can be very difficult, but just calm down. Understand that even if it is a heart attack, your fear would only worsen because you think it's heart attack.
Mhm.
Even if it is
Right.
heart attack, the only choice is for you to remain calm there, because you don't want, when you get anxious or stressed, your heart beats more faster. You're making your heart to work twice the normal. Obviously it gives up more quicker and more easy. So even in the worst
Right.
situation, you have to try to remain calm. Tell yourself and let the family members tell that, like, it's going to be okay. Don't have a group that mobs you and says that, are you okay? Do you need
Right.
something?
Right.
No. Just
Right.
one person, give some air for the person to breathe, and just, walk them around, move their body, give them a glass of water, right?
Mhm.
If they want some massage, if they feel some part of the body is tensed, ask them, let them relax it a little bit on your way to hospital. But usually with panic attacks, we always give a SOS medication. We always tell patients to carry it. It's must, because sometimes panic attacks can cause heart attacks. It can, because your heart is beating so fast, right? So we always tell them, you're on a flight, you're in an elevator, you could have a stimuli that causes fear, or not have fear. Always carry. Sometimes I even ask my patients to write down that, if you're finding me in this situation, please put this under my tongue. So someone next to
Mm.
you can show them and they can immediately put it. So yeah, panic attacks can be bad. The first visit to the hospital can be, it's a memorable ride for all the wrong reasons. Yeah.
Okay. Even the grounding techniques help during a panic attack. So, seeing five things that
Yes.
you hear, five things that you can smell.
Yes. So I think a basic idea is to for you to trick your brain into reducing production of anxiety hormones. In turn, heart, all the other organs will calm down. So grounding can work if you're going into a panic attack, but if full blown panic attack, I'm not sure, but it'll relax a little bit for sure. So like you said, so grounding exercise is using all your five senses to stimulate or to suppress, not to stimulate, sorry, to suppress your secretion of hormones. So
Mm-hmm.
you can look at five things around you. You can touch four things. Hear three sounds. Smell two things and taste one thing. Something pleasant, obviously. That will definitely help. And sometimes you might need assistance from someone else next to you. I was watching this series on Netflix recently. Uh, Feels like ish. I don't know. I forgot the name. It's a series. It's one of those teen series. They
Mm-hmm.
beautifully demonstrated grounding exercise. Actually, I'm gonna like upload it on my page later. This
Okay.
girl is having a panic attack because she remembered some trauma from her past, some abusive relationship she went into. Yeah, someone says it feels like it.
Yeah.
Her friend, uh, calms her down so beautifully. I think
Mm-hmm.
that will tell you what exactly grounding is and how it actually helps you.
Okay. Okay.
Or even
Uh,
simple thing like sorry simple thing
yeah,
like counting a large digit backwards. Close your eyes and take a large number. Randomly I can take 958 and I can close my eyes and be like
mm-hmm.
957, 956, 955. When you reverse count, brain can't multitask unless you're Einstein. That's different, but otherwise it can't multitask. So that's a way for you to brain to distract from that. Yeah.
Right. Talking about the brain, you mentioned the pituitary gland is involved in the stress response, calming down. So, what happens inside the brain when we perceive a stressor or when we see that something, no, I see a snake in front of me right now. What happens inside my brain?
So same thing. So brain can't see. Our eyes can see, but our visual center is in brain. It's here. It's called occipital area, right? So when I'm seeing something, and I know that this could be a poisonous, you know, animal, I don't feel the same if I saw a butterfly. Because
Right.
honestly, when we are growing up, we are fed with some things like this is dangerous, this is not dangerous, or this is safe, this is not safe. We already have an idea about it. That's why when you see a kid, for example, when I was a child, I had a picture where I was playing with a jeep and there is a snake next to me. Accidentally, snake came in and I was just looking at the snake. I didn't have a panic attack, obviously not. But as I'm growing up, obviously my brain is already fed with the information, just like your hard drive or hard disk. That immediately when I see it, it stimulates that past memory of what's your idea of like dangerous or safe. That this eye will give signals to the brain, and the brain will secrete. Brain has like different areas, there are different levels, so it secretes. There's a hypothalamic pituitary tract. It sends like signal to one and signal to another, and that finally ends up releasing something called as catecholamines. Catecholamines are called fight or flight hormones. Name itself tells you flight, run away, or fight, face it. Obviously, if it's a snake, I would rather run away, not face it,
Right.
right? If it's an exam, I would rather face it, not run away. So that's a
It also
natural,
depends on every individual.
yes. Yes, depends on every individual. But I'm talking about like this regular, like if somebody is not having anxiety or anything. So actually anxiety is a God's gift. Stress is a God's gift. I might sound very weird saying it. That actually it's a mode of safety for us. It's what prepares us to fight a stressor or ward off a stressor. If you don't have it, you know, you just can't function. If you don't
Right.
have stress about exams for tomorrow, you won't be studying, you won't be performing. But the problem is if the anxiety is too much or too little, both are problematic. So you have to have a balance.
So that was the good kind of stress, the you stress,
Yeah,
which you
use
mentioned.
stress.
So you
Use
you
stress.
you need to have some kind of you need to have some kind of a motivation of sorts to work towards your goal.
Yeah.
So how helpful can it be? To what extent is you stress still in the good range? And when do we identify it to be the bad kind?
I think a simple thing is if it is affecting your functioning. For
Right.
example, let's just say that you're getting married in a week, especially to a stranger that you don't know. It's an arranged marriage. It's very normal that you're stressed. It's actually abnormal if you're not stressed. So, but are you able to function? Are you able to go to work and give your best? I'm not saying the best. Give your best at the work. Are you able to come home and able to be okay with everybody in your family, right? And are you able to convey to people that I'm feeling stressed? And when they calm you down, you're able to be calmed down by people. That is eustress. That is normal. But distress is when your socio-occupational functioning, what I mean is personal and professional life, when they topple, when they go upside down, that is when it is a distress. So this marriage, the same marriage, I'm going to work. I'm not able to focus on my work. I'm getting irritable at people. I'm feeling very sad. I'm not able to recall things. My memory is fading a little bit. I'm not feeling like eating. I'm not socializing with my friends. I'm not even telling people I'm feeling stressed. Or if I tell, when they tell me it's going to be okay, I'm getting irritated at them. Or it's not. Nobody is able to calm me down. That is a distress. So it's
Right.
simple. Your functioning is getting affected or not. But then there's a third category called high functioning anxiety. I think most of the
Okay.
doctors fall into that. They're functioning so well with anxiety. So I think that's a different topic in altogether.
There's a question in the chat asking how does stress analgesia work?
Stress analgesia. So there are two things. One is stress can actually increase the perception of pain. You'll feel more pain. A lot of people who come with headaches, we do a CT, we do all of that, and then everything is normal. There is no tumor or any cancer of the brain, nothing. Not a hypertensive, none of that. But I'm having a lot of pain. That could be stress induced because something called a substance P that gets released in your body, right? It's one of the neurotransmitter that transmits the pain sensation that makes you perceive and feel the pain. It could be physical pain or emotional pain. If you look at pain, pain is a very vague thing, isn't it? It's not like, let's just say you and me are riding a bike. We both fell down with the same intensity. Not both of us feel the same intensity of pain, right?
Like,
So each of us have different vulnerability or susceptibility for a threshold for pain. It's same for emotional pain as well. Let's just say we both are siblings and we both, God forbidden, lost our parent, right? Maybe you and me are not feeling the same pain. Maybe you're feeling a little more than me, or maybe I'm processing a little better than you. So stress can actually increase pain conditions. Like a lot of orthopedic cases come to me with like neck pain, back pain, not improving on painkillers or just taking a painkiller and getting better only for that 6 hours after the tablet intake. Most of them have the stress induced. But I think what she's asking is stress analgesia. Analgesia is loss of pain, like lack of pain. That can occur because of numbness. So stress also causes numbness. Numbness is where you're not feeling anything. So
right.
that can occur.
So how do you deal with this stress, or how can one manage this distress? And what has worked for you? There are some things
Yeah.
some individuals respond to better. And so what has worked for you?
Yeah. I think first thing is if you are the best judge of yourself. Don't be in denial. Most of us are in denial that, no, I think I'm fine. Like, most of us, smoke a cigarette and be like, you know what, I'm feeling fine. This patient was telling me today morning that the moment I asked her, what took you so long to come and see me? Because you said like for 7 years you've been going through anxiety. She's like, I was getting better with smoking. The moment first smoke hits my chest, my muscles are relaxed, my heart isn't beating as fast. I'm actually feeling little happy, and I'm able to socialize with people because others are also smokers around. So she's like, I felt better. But then, in fact, smoking is worsening anxiety, right? It's a drug that is getting you addicted and makes you crave for more, gives you more reasons to smoke again. Besides worsening anxiety, obviously, it can cause lung cancer, oral cancer. There are many other list of things that it can cause. So I think the first thing for managing stress is to get your basics right, not doing some great, Pilates class or, I don't know, not something great. Get your essentials right. That's about mental health. If you take care of your basics, fine, you're gonna be okay. You can't conquer genes. Genetic is something that we can't do anything better, but environmental triggers can be modified. First thing is sleep. Sleep is the most important thing. That's the only time your brain is resting. It is going to produce the neurochemicals required for the next day for you to function well at your optimum capacity. But why psychiatric problems or mental health problems are increasing in today's generation? One is obviously, the awareness is better, so people are knowing that, okay, I'm going through something. Besides that, that is a good thing. Besides that, the prevalence also is increasing because most of us, our sleep habits are erratic, they're horrible. I'm sure, like I'm speaking of myself, my sleep habits are horrible. In spite of me telling so many people how to sleep right, it's just the nature of my work. I can't do any better. So sleep is the most important thing. The do's and don'ts about
Right.
sleep. Patients ask me, doctor, what are the good sleeping techniques? I said, just the opposite of whatever you're doing. Rather than me wasting another 10 minutes, right? Change everything that you're doing about sleep. Um, should I go to bed early? If you can, yes. But if you can't, it's okay. See, sleeping early is the best thing. But if you're not able to, at least maintain your sleep timings. Don't just confuse your brain with your sleep timing. For example, I sleep like around 1 o'clock and I wake up around, let's just say 7:30. That's my sleep timing. I'm not gonna reverse that no matter what. Just because it's a weekend or I'm on a long leave, I'm not gonna sleep more. Maybe a half an hour, 1 hour more for the privilege of it, but not like I wake up in the afternoon or I eat and go back to sleep. Don't do that. Like Sunday sleeping excessive, not good. Do not take naps in the afternoon. People who take naps in the afternoons are the one who struggle to sleep in the night later. Some people tell me, but I'm sleeping well in the afternoon night. What's the problem? But I'm talking about later. Later also you're gonna suffer. It's not just right now. The world isn't gonna end. We're gonna be okay. So you have to take care of your health for much longer time. Eating early. All our parents tell us, why don't you eat early? We're like, oh, come on, give me a break. But it has scientific evidence. The food that you eat has to get digested and it has to reach your brain, it has to get absorbed, and your brain has to feel nourished for you to have a good night's sleep. At least 3 hours before you go to bed, you need to sleep. And simple thing would be start exercising in the morning. That's another great way for you to reduce your stress because endorphins that are released during exercise will help in reducing your stress levels. This endorphins is not only when you hit a gym. It can be you take a flight of stairs, you start just jumping out of nowhere or start dancing for a favorite track of yours. It can be anything. So you need to get your body moving. That's the first thing. Another way to reduce your stress levels is to hydrate. Such basic things I'm telling you because we are not doing this. Hydrate. 5 liters at least water per day. Indians have nasty habit of not drinking. Only in summers when you come from outdoors you drink. That too maybe a soda or like some soft drink or something like that, but not just water. So hydrate well. That is one important thing. Another thing is, learn to manage your stresses and learn to anticipate your stresses. Most of us, we don't see things coming. See, pandemic, clearly we didn't see it coming. That's okay. But a lot of our other personal or professional stresses, there is this toxic positivity also. Sometimes that also is it's not good. See, call spade a spade. If you think like, this is something that's going to affect me, or this is something that I can control or not control. Divide everything in your life into or to your right, everything that I can control, to your left, everything I can't control, and just ignore about the things that you can't control. I know it's not that easy, but once you write them down, I write things down once in a while when I think I know I'm having very severe anxiety. I write down things that, okay, you know what, I can control this. I can't control this. When I look at it, the same brain that saw a snake that gave you anxiety is going to give you better mental health. So that's one way to do it. Like we already mentioned about grounding and deep breathing, reverse counting, or imagining the most pleasant place that you've been to. Or actually, sometimes when you have too many thoughts, I tell my patients to take a printout of a stop signal at what you would see at a traffic signal, and just stick it where they would go and sit when they're anxious. That also you can do, because visual stimuli is very, very powerful. um, so if you can do that, I think that's great. So I think these are simple things you can do. And one important thing is, don't imagine the worst thing that will happen. Don't be like, oh, if I have a breakup, that's going to be end of me. If I lose this job, that's going to be end of me. If I fail in this exam, that's going to be end of me. No, it's not going to be end of me.
Right.
Right now I'm sitting in front of you. How do you know if I passed my MBBS in first attempt or second attempt, third attempt? You don't know. You
Right.
don't know at all, right? You only will judge me if I'm good or not based on what I'm speaking right now. Nothing more than that. So try to work on yourself, work on your communication, work on your presentation, and don't get too fussy about being very successful. I think most of us are success driven. I'm not one of those influencers who will tell you tips to be productive and successful. I just think you should be happy, and you should choose something knowing its pros and cons, and be okay with it even if it fails, right?
Right.
Just own it. I think simple things, if you frame your personality in a way like that, I think things don't stress you. It took me a long time to get here where I'm able to say this thing, because I changed myself to believe these things, and it
Right.
turned everything around. Like everybody around me, when they're keeping on getting stressed, they tell me that probably you're not stressed because you're a psychiatrist. That's not true. That's because I trained myself as a person, not as a psychiatrist, to start looking at things as like, okay, you know what, like, okay, I think this is going to stress me, so I'm going to stay away from it. It's very simple. It's as
That's
simple thing as all your friends are meeting somewhere, and you want to go, but you're scared of COVID. You're so stressed about, should I go or not go? Simple thing. Do not go. Instead,
right.
engage in some other happy activity. It's that simple. That simple decision, sticking by it. One last thing to manage stress is to please have a hobby. When I ask people what is your hobby, they say I'm watching movies, talking to friends, listening to music. No, those are not hobbies that will reduce your stress. They will only distract you temporarily. Get a creative hobby. It can be art, it can be craft, it can be baking, it can be, there are thousand activities, a lot of things we don't even know what are there. There is knitting, quilling. I'm actually knowing a lot of lot of things these days, with pandemic. So get a hobby, and who knows, what if that turns you into a professional? You never know. So yeah,
Right.
things like that.
Right. Does having the knowledge of psychiatry or psychology or how the brain works give you an upper edge of sorts on dealing with stress?
Yes and no. Yes, because I think just I'll cut the chase and I'll tell that doctors are the worst patients. Because somewhere we are like, okay, we know it all, so we tend to ignore about our health. I think that's something that I'm trying to change thanks to the pandemic, because I'm able to like get some time for myself, and also not because of increasing patients of anxiety and depression needing us to see a doctor. um, so yeah, I mean, I know how it is, but I don't think so I'm taking enough care about it. Yeah, but it's a yes and no. It's definitely yes and no. Yeah.
Okay, I see. Uh, Coming to the next question, how has the
But sorry,
pandemic?
but
Yeah,
having a doctor friend or doctor family member is very helpful for the others. I don't think so. Being a doctor is helpful for your own good for sure. I don't know. Yeah,
yeah.
sorry. Yeah, please go ahead.
Yeah. I was asking, how has the pandemic, changed the stress habits of people or how people cope with stress better going through the pandemic?
I think strangely people are very scared when we had 10 cases in our country, and now with like I think 3.2 crore cases, people are not as tensed. So I don't know like what's going on in people's like brains. I don't understand exactly. But I think definitely did pandemic increase mental health issues? Yes. Skyrocketed actually. Um, Half of them are very new to mental health conditions, and half of them who've been struggling and who were able to cope up with like socializing or different things. Now that lack of all of those things, they're just stripped of all the layers of comfort and support. Now they are surfaced, so there are, but overall it's definitely increased. How are people coping? I would say like some of them are doing wonderful. They are prioritizing self. A lot of homemakers who are in abusive relationships and everything, they are finding a niche for their own. They're using social media to their best advantage, and they're doing great job. Like it's very empowering. um, but some of them are just like the problems are too big for them. There is a job insecurity, financial strain.
Right.
Everything is just disrupted for them. It's easy for me to sit in an air conditioned room and talk different things, but it's one thing to not have a house on your head and are scared to pay rent by the end of the month. I think that's a very different stress in its own glory.
Right.
So
Right.
yeah, I mean, some people this way, some people that way, I think.
Do you think people got immune to the trauma over the course of the pandemic?
So I think a lot of people don't believe in this, but I definitely believe in time. um, I think time is one of the best healers, um, provided if you want to be healed. You know, same thing if it's grief. Like if you lost somebody, if you had a heartbreak, if you lost a pet, or a pandemic, something like pandemic, where you lost your social support system. At least like the real support system is gone. Um, I think people are finding innovative ways. There's so many apps that came up, rise in so many online business. People are able to adapt. I think that's the most blessing about being a human. We're the most evolved species, no doubt, unless proven otherwise, right? Um, unless there are aliens who are like much more smarter, I don't know that. But so far we are the most evolved species. So our we tend to adapt. We tend to adapt through everything and anything. Most of us do. So I think people are doing okay. Also, thanks to mental health issues being so much on the forefront. It's a flavor of the season, as someone called recently, that people are aware. But even the mental health awareness has to be, I don't know if I can say this, has to be moderate. It shouldn't be too much. You shouldn't like day in day out just keep listening to psychiatrists or psychologists speaking about mental health. I think that also makes you think that okay, probably oh, what I'm feeling maybe is abnormal, right? So I believe in balance and moderation as a person. You want to eat pizza, go for it, but balance it, moderate it. You wanna engage in an unhealthy habit, go for it, but you have to moderate it. You have to balance it. If you don't have that capacity, don't even start it. It's that simple. You want to know what's happening in the world. You're interested in having being the most smartest person in the room. Watch news, go for it. But if you think news is overwhelming you, stop it. So it's very simple like that. Did
Right.
I answer
Right.
your question?
Well, sort of, yes.
Yeah, yeah.
There's another question in the chat box. Do you think post-COVID mental health awareness has increased?
Well, we are not post COVID yet. We are in COVID, like in the middle of COVID. Yes, mental health awareness definitely has increased. I think, uh, but yeah, it is increased. I mean, I hope it's just reaching the right crowd. I hope it's reaching villagers, and how many of the people logged in from a village who don't know what M of mental health, right? So I don't know if it's reaching. I think it has to be reached. So there should be local languages, and there should be a lot of people doing involving that group as well. Not just tech savvy youngsters like you and me. That I'm not a youngster, but like tech savvy people. Yeah.
Yes. And lastly, would you have any advice for our viewers on how to, cope up with their daily stressors?
I think I gave so many advices, but just know that if something doesn't work for you, it's okay. Don't be like, the deep breathing isn't working for me. The grounding technique isn't working for me. I think there is no hope for me. No. You know, like I said, because we are smart, we can always figure out things that work for us. You just have to be open to it and understand that, listen to your body, like, okay, you know what, this is affecting me. This is how I'm getting better, and I'm gonna do this. And how I'm getting better is a healthy way, not unhealthy way. I'm not going and having 5 shots of whiskey, and I'm sleeping off and forgetting the pain for that evening. No, not that. Right? Try to do it in a healthy way, at least like a moderately healthy way. I think that's the only advice. Don't be so stressed about the advice that I gave also. I would have asked you to do, because this a lot of patients come back and tell me, doctor, you told me some 10 things to sleep well. I'm doing all of this. Maybe one or two things I'm missing. That's giving me anxiety. I'm not able to sleep. So
Right,
that's an advice. Like, not all of them you have to do. See what suits for you. Frame your own. It's like cooking recipe. You change it. You put the salt that you want. You put the spice that you want, and make your own dish. Something like that. Mental health is something like that. See what works for you, what doesn't.
right, right. Good. If anyone has any questions in the chat, we will wait for them.
So I
Or
saw this question in the beginning. The same person who asked about panic disorder, can we treat with medicines? I said yes, you have to treat with medicine. They asked if they are addictive. Uh, so there is a big misnomer, or not misnomer, sorry. Misinterpretation of psychiatric medications. Unfortunately, I think probably because of the olden generation medicines were addictive. Some of them, not all of them, they were addictive, and I think people are still in that same
right,
understanding. But the new molecules are non-dependent. Um, like I said, I had clinical depression myself, and I'm not taking medicines now, and I'm perfectly fine and sitting in front of you, and I achieved a lot. So just know that, go to a doctor. Nobody's going to open your mouth and pop pills into your mouth. Have a discussion. See if the doctor is able to change your belief. Most of the patients come into my room thinking I would give them therapy in 15 minutes. I would tell them, no, that's not possible. Right? I can't. Like, for me to even know you, I will take like an hour, maybe. Um, so I will probably, my diagnosing my patient's condition is very easy for me. Actually, convincing them, to understand the need of medicines is very important. So that counseling is more than actual disease. So see if the doctor, have discussion with your doctor, and be open. Don't be like, doctor is trying to trick you into medicines. Tricking you into medicines won't fetch me anything or won't take me anywhere in my life. So I won't do it. It's
right,
not my own medicine that I'm selling for money. So
right.
yeah. Yes, but mild conditions we can manage without medicines. Definitely, sometimes it's just vitamin deficiency that causes severe anxiety. We would evaluate and we'll see if you need to be given that and how much to be given to you. So that is something that doctors can do. So most of them are not addictive. There are a couple of medicines that probably are dependent over a period of time. Just like alcohol, if you drink for 1 month, you won't be addicted. Somebody
Right,
who's been taking for years together can get dependent on it. Just like that, some of the medicines, very few of the medicines, like maybe 3, 4 medicines out of 200 tablets that I know, can be addictive, that over a period of time. Usually, we choose to give them in, like, let's just say, terminally ill patients or somebody who is very old. We don't need to care about stopping them anytime, and we need to give them good sleep and reduce their anxiety because they have severe anxiety or severe pain because probably they had some surgery and the wound is not healing because of diabetes. There are many cases. Them,
right,
we don't really care about addiction and dependence, all that. We just want to give them quality of life, right? In that cases, we'll give, but otherwise we don't. But some doctors might give you olden class drugs. But again, you'll be able to judge and sense if the doctor is right for you or not. If you think it's not right, just get a second opinion. There's nothing wrong. It's your body at the end of the day.
right, right. Good. There's another question. If clonazepam is a great tablet for anxiety.
So there are different kinds of anxiety, like like how one shoe doesn't fit all. There are different kinds of anxiety, so you'll have to be evaluated. So there is no, the answer is not just simple yes and a no. you'll have to be evaluated. But it's a good drug, uh, but it can have slight dependence over a period of time. So usually we give it in like panic attacks because it's so severe that you have to give this medicine and not care about dependence. But otherwise, usually I would like refrain. It's a good molecule. Every molecule is good when used in right indication. When it's not used in right indication, it's not good. At the end of the day, it's a molecule. So
Right. There's another question. If we recognize symptoms of a mental health disorder in ourselves, would that be considered as self-diagnosis? And how do we draw the line between harmful self-diagnosis and recognizing your illness?
don't like I would say, like don't put a label or a diagnosis on it. Some patients come and tell me. I ask them like what's happening. They tell me I'm having migraine. Um, I'm having panic disorder. I'm having insomnia. They use medical terminologies. See, not able to sleep is not insomnia. There are many other things together with not able to sleep is called insomnia. So always know your symptoms, understand your symptoms, but don't arrive at the diagnosis because there's so much that goes behind to diagnose a condition. It's not simple, just Google, are you having this? Yes, no, and it leads you to diagnosis. It's not that simple.
Yes.
So never self-diagnose. Never Google symptoms, I would say, not because I'm a doctor and I want you to come to me and give me some, make me rich, not because of that. Me as a person also, I never, even before also, I never was Googling any symptoms. It was always like, you know what, there is a professional for this, I will go for that person. If I can't afford, there are doctors who treat for free. I would go for that doctor. I would always go to a professional. If I had to build a house, I won't Google it and build a house. I'm gonna go to somebody with a skill set. So don't diagnose yourself. Any self-diagnosis is harmful, but
Right.
understanding
You-
symptoms is is definite, because you need to go to a doctor, no, to tell that, doctor, I'm going through this, and this. Could it be depression? You can ask that.
Yeah. I think getting help for your symptoms is the more important part here.
Yeah.
If there are any more questions, yes. If there's another question, if you trust fluoxetine, risperidone, and
Peripheral.
T-central medicines in anxiety, stress disorder, repetitive behavior, OCD, and everything.
You gave 3 different medicines and 4 different conditions, so I don't know how to answer that. But some of the medicines you gave work for OCD. Some of them you gave can work for. There's nothing called repetitive behavior. See, if you have repetitive behavior, I won't give you medicine unless I diagnose it as OCD, right?
Right.
So I think you need to once like see somebody. I think they'll be able to clear better because I need to ask you so many questions to understand this question, which I can't do right now.
Right.
Yeah.
So I think we'll end the session here if nobody has any more questions. Yeah. Thank you so much for such an insightful session, for taking the time out. I think we all learned a lot about stress and how to deal with it. I learned a lot more about myself and how I need to change my pattern. So thank you so much for that.
Yeah, sure. Thank you for the opportunity. Take care and stay safe.
Thank you.
Bye.
Yes. Thank you so much.